Good morning, everyone. Thank you all for joining us. We haven't seen you in a few months, so happy New Year. It's hard to believe it's already February. We have a full agenda today and several guests from the community. So without further ado, Emily and Sarah, do you want to start from Station MD?
Sure. Hi, everyone. I'm Emily Martinez. I'm the account executive from Station MD. Some of you may remember me from before. I was the SSA director in Mahoning County for many years and was the chair of the statewide SSA directors work group. So I've worked for a county board for over 21 years and just left back in May to come to Station MD. So I am actually going to be on one side of Ohio, and we just hired a new account executive. Some of you may know her. That's Sarah Davies. I'll let her introduce herself to you, and she will actually be the account executive for your county. I'll still be here. But we really appreciate Hamilton. You guys did an awesome job. Everyone that was on the Station MD pilot enrolled by the Hamilton County Board has transitioned over to the waiver. So we really appreciate that. I'll let Sarah introduce herself and we'll get right into the PowerPoint.
Hi, everyone. So I'm Sarah Davies. I have been lucky enough to interact with many of the counties and providers over the last 5 or 6 years. So I'm very excited. It's my second week at Station MD. So I'm kind of just sitting back and taking notes, but I'm really excited. Always had a great relationship with Hamilton County and the providers there. So I will make sure to throw my email in the chat, and whatever you need, just let me know.
Thanks, Sarah. We'll go ahead and get started. If you guys have questions, let us know. We'll leave a few minutes for questions at the end. I know you have a packet agenda, so I will be quick. Station MD is a nationwide company. The service we offer is called healthcare assessment. It is now on the waiver, yay! And that went into effect on January 1st. So that's all three waivers. Providers, SSAs, if you're on here, folks can go ahead and enter the service. It's like any other service and support. Got to have an assessed need, put it as a service and support, and then it goes on the cost projection tool. There's information in this PowerPoint on how you do that. And so, Karen, if you want to send this PowerPoint after today's meeting, you are more than welcome to. Our main goal at Station MD is to help people with intellectual and developmental disabilities thrive in their community. And so, what we have is the healthcare assessment. It is 24/7 access to a specialized clinician. The best way for me to describe it to you providers is it is like a doctor in the pocket of your direct care staff, your nursing staff, and the individuals that you serve. The service is intended to help individuals, but there are significant benefits to you all as providers. Number one, Station MD is a subscription service. So when someone enrolls, that gives them 24/7 access to a specialized clinician. So, some of the ways individuals use Station MD are reducing their emergency room visits. They can call in and have a virtual appointment with a doctor 24/7. So it helps them gain independence, have access to virtual healthcare, and all of our clinicians are specialized. So it's not like going to the emergency room or urgent care in person or even virtual. They're specialized. They have special training in working with folks with developmental disabilities. So they're going to understand if someone lives in a congregate setting, an ICF, lives independently, has a nurse, doesn't have a nurse. They're also going to know how to work if you're calling in from your workshop or their day program, adult day support, their employment site. They're going to be able to patch in the nurse from your agency if that's needed, or maybe patch in mom if that's needed. And individuals can use the service for urgent care, any non life threatening medical issue. We also do medication refills. We'll help guide staff and individuals and families if they have medical questions. Um, we will help give guidance if there's been a medication error. And then also, if someone's having a behavioral outburst and needs some help to de escalate, we can help with that as well. So, lots of ways to use the service. And one of our biggest accomplishments is helping people decrease unnecessary ER visits. You guys, as providers, know whether you're a workshop, day program, or HPC provider, going to the emergency room is often our only option. Um, Station MD aims to fill in that gap so that when someone has pink eye and they can't get into their primary care doctor, they don't want to go to urgent care, they're suffering and they just feel awful. Call Station MD, have an appointment from home, and pick up those pink eye drops at the pharmacy that's been called in, right? We want to prevent you all from having to go to the emergency room when it's unnecessary. We know that folks with IDD go to the ER when there's no other option because they're high risk, they have lack of access to medical care otherwise. Regulatory requirements, right? Your MUIs and UIs. Someone had a med error, everyone's freaking out, off to the ER you go, right? And now you're backfilling that shift and dealing with someone being admitted when they really didn't even need to be, right? Instead, they could use Station MD. And as a part of our process, we, like every other doctor, have the visit information that you as the provider would have access to. So you would have um, documentation that they were seen, what the guidance was, all that good stuff to meet your regulatory requirements. Folks also go to the ER if their primary care doctor lacks immediate availability. We hear that constantly. This service is an add-on, doesn't replace HPC, nursing, or any of their regular doctors. You keep all of those. This is an urgent care. It's just in your pocket. You can do it from home. The emergency room experience is obviously, it's awful for everyone, right? The individuals, it's scary. They're exposed to infection. It disrupts their routine. Sometimes they miss their meds. And transportation is terrible, right? If someone has to go in an ambulance, it's awful for them. And then we hear from providers all the time, they don't have a vehicle. They're hiring staff that can't drive. And maybe they as an agency don't have a vehicle. We've also been hearing from lots of day program and employment providers that folks are coming in, they get sick, a minor cut, they have a seizure, a rash, and they can't get a hold of the family or the residential provider. So what happens? They're leaving the workshop to go to the ER. Instead, the individual could just go into a private place and have a medical appointment from there virtually. For our staff, obviously going to the ER unnecessarily increases stress. It worsens our staffing shortages because if one staff's going to the ER with somebody, we have to backfill that shift. Also, lots of people spend hours in the ER, and sometimes that means overtime pay for you all. It's their time spent in the ER, sleep deprivation, and then also those staff are exposed to infection. As I said, one of our biggest goals and our biggest accomplishments is treating people in place, meaning folks that are enrolled in Station MD do not need to go to the emergency room, but they still get great health care. This slide shows you our top diagnoses from 2024. So these are all medical diagnoses that we get calls in about all the time: rash, cough, seizure, vomiting, COVID-19, the flu, urinary tract infection, pink eye. These are our most common diagnoses that folks call in about, but you can call in about any non-life threatening issue. In the blue, for these most common diagnoses, this is the 93.2% of the time folks were treated in place. So in 2024, folks enrolled in Station MD, 93.2% of the time when they called in and had an appointment, their issue was handled. They never had to go to the emergency room. Just think about that as a provider, how much that would help you and help the individual that you serve. In the orange, like you can see with the vomiting, the little less than 7% of the time folks did need to go to the emergency room. Important to note, as a part of the healthcare assessment service, if someone calls in and let's say they've been vomiting for 2 hours, our doc is going to say, I'm concerned about dehydration. Let's get Bob to the emergency room. Where are you going? And then as the staff go, our doc is going to call the emergency room, let them know they're coming, give initial information, and say things like, hey, Bob is nonverbal and he's very upset. He's so sick. He can't really express how sick he feels. So he's starting to get violent. Can you please set up a room for him so everybody is safe? Hospitals love that information so they know what's coming into their ER and can have a conversation doctor to doctor. Who benefits from using this service? Well, everyone does, right? If you're a provider, whether it's day program, workshop, or home, you, your staff, your nurse, the individuals you serve get immediate access to a doctor. It will reduce the need to go to the emergency department or urgent care, and it's going to improve people's lives because now they have an option to get virtual care from home from a specialized clinician. So when can folks call? Well, number one, once you're enrolled through the ISP, you can call 24/7. Middle of the night, New Year's Eve, we will answer. Again, people call in for medication refills, medication errors, simple medical questions. Hey, the person that I'm serving has a really bad cough. What should I do? Or, hey, this individual has elevated blood pressure. What should I do next? And the doctor is going to give you, your staff, guidance. Want to mention that lots of providers have nurses, and of course, some don't. And we work with your nurse as well. Some providers kind of have their own specific procedure that their nurse kind of guides for how folks use Station MD. And we love working with nurses, and nurses love our service. So we really like to work together with our providers and be an additional support to you all to help you support the individuals that you care for. And again, we do get lots of potentially serious questions. We'll provide guidance, and we will say if someone needs to go to the emergency room. Obviously, another of our big goals is just adequate healthcare, equitable healthcare for the individuals that we serve. We don't have it, but now we do. Now we have this opportunity through the healthcare assessment that's approved through Medicaid, that's approved on the waiver, and we're really excited to be able to offer this. If someone is calling in, we want to give peace of mind to the individual and their staff. This is an early assessment to prevent something from becoming life-threatening. And we feel really strongly that we provide guidance to your staff so that they feel empowered to know what to do. And then we follow up as needed after the appointment. Important to note, our clinicians are all trained in behavioral health, so we can help de-escalate a situation. We'll look for what is the medical reason that someone's agitated, anxious, or depressed. If someone needs a psychotropic or a controlled substance, because this is virtual, we're not allowed to prescribe those. That really doesn't happen for us because we're usually able to figure out what's going on and help to de-escalate the situation. But if someone needed a psychotropic or a controlled substance, they would help them transition to the emergency room to get to the psych unit. The service I'm talking about now is healthcare assessment. I did want to mention that we do have behavioral health services. We offer psychiatric services. We can become someone's psychiatrist and they have virtual appointments with us. That's private pay through a contract with you as the provider or the county board. That's not on the waiver, but I did just want to mention that service. Also wanted to mention that we do serve youth. In our urgent care, we serve youth of any age, and we do have lots of contracts with ICFs across the state, especially for youth. And we are also offering psychological evaluation contracts for both providers and county boards. If you're interested in that, certainly let me know, but we've been hearing that across Ohio that that's really difficult. For our psych evals, we serve youth 6 and up. So how does it work? How do you call? Well, providers, it's very simple. The SSA obviously needs to add the service, and then you just need to make sure you have a device in the home. Laptop with a camera, smartphone, iPad, tablet, that's all you need. And then, of course, Wi-Fi. When folks are calling in, it's extremely easy. Your staff are going to call our number, 1-877-STAT-MDS. A receptionist is going to answer, or it goes to a voicemail and you leave your information and you get an immediate callback. Just depends on the volume that we have at the moment. And then just like you're at the receptionist at your regular doctor, you're going to give the person's information, name, date of birth, their vitals, a callback number, and what are their symptoms. We are then going to confirm the information we already have with you. As a part of the enrollment process, we have an enrollment form that the provider fills out with all their medical information and who the after visit summary should go to. And of course, their meds and their pharmacy. Just like when you're at the doctor, we confirm that, hey, is this still your meds? Is this still your pharmacy? And then basically all we're doing is asking your staff, okay, do you have the Station MD app on the tablet? If they've used it before, they do. They click on it. We give them the code. They enter, the 4 or 5 digit code, and they're in the waiting room. They're in a secure, HIPAA confidential Zoom platform. So it's extremely easy to use. The first time a staff uses it at your provider location, our receptionist will help them set up their site and get the app on, their tablet, computer, whatever it is. That has never been an issue. But as a backup, if there's some kind of something going on, I'm not at the home, or I can't, I don't have access to the app, whatever, we also can just text or email them a link to get them into the secure Zoom platform. We try to make sure we have a backup just in case there's an issue. And then they're in the waiting room waiting for the doc, and we'll have their virtual appointment. I always remind providers, blood pressure cuff, thermometer, pulse oximetry meter that you put on someone's finger, should really have those in the home anyway. If you don't, you can pick them up at a local drugstore. They're good to have. If for some reason we don't have someone's vitals, we will still have the appointment, but it is best to have them because we're going to get the best outcome from that appointment. And I always tell providers, just be prepared. Tell your staff how it works. Hey, on the med card, here's the tablet. Here's the folder with everybody's information in it. So when they first call in, it's an easy breezy appointment and the individual has the best outcome. And the best thing of all, they're at home. I always remind providers, if you don't have a device or Wi-Fi, get with the team. Don't let those be a barrier. There are so many resources out there to help folks get internet and get a device. You don't need to buy anything specific. A $50 Amazon tablet is perfectly fine. Again, benefiting from StationMD, it's everyone, right? Providers and individuals get access to a doctor. It promotes health and wellness, and helps individuals with any of their medical issues. Just wanted to mention, we do also have a medical director service. Lots of ICFs have been asking about this because they're struggling to get a medical director. Certainly, if you needed that and were struggling to find it, you could let me know and I would help you understand how that works. This is the plan information. We've been sharing this with everyone so folks know how to enter the service. And then the codes on the cost projection tool. The cost per month is only $34.50. It does come off their HPC budget, but it's very inexpensive and you get a lot from it, right? This is really how to enroll the person. You got to go through the SSA. There has to be an assessed need. Everyone has an assessed need for healthcare, right? Whether it's to gain independence, to do more of the medical care on their own, to help reduce ER visits, to help them maintain employment or a day program. There's a variety of reasons and it really should depend on the person. And then, as I said, it's going to go on the plan. Once it's on there, they're ready to go. We're not waiting on anything. They can go ahead and start calling in. This is my contact information. And as Sarah said, she was putting her email in the chat. Does anybody have any questions about healthcare assessment?
So
Jen,
I
you have a
have,
question?
I have one question. I'm sorry.
Sure.
Go ahead,
No, you're
Nika.
good.
Yeah, so I was not, the cost is going to be, you said $34.99, and then that comes from
Yep.
the individual's budget, or would the providers be responsible, agencies or providers be responsible for that cost?
Oh, good question. It's $34.50, and yes, it comes off their waiver.
Okay.
So no, there's no cost to the provider and there's no cost to the individual.
Okay.
Yep, it's just $34.50, and that gets billed to their waiver monthly through their HPC budget. So it's not making anybody go into PA. It's very inexpensive. And
Okay.
then once, that gives them access to the 24/7 service. So, it's very inexpensive for the $34.50. When they have a visit with us, we bill their Medicaid for a regular visit. But again, we never bill you or the person.
Okay. Okay, cool. Write this down.
Jim, did you have a question? Go ahead.
Yes, the $34.50 comes off of each person. I'm a shared living provider. I have 3 individuals, and so I should register each of those 3 people into the
You got it.
program.
Yep. You
This
can
is a
just call
great
their SSA.
program. I have just finished with unanticipated hospitalization. The one thing that jumped out at me in your presentation was that when you have assessed that they are a candidate for an emergency room visit, you call ahead of time. That is a huge gateway opener, because I can recall we sat in an emergency room for up to 2 hours with my daughter at that time was just vomiting and in great pain. And it was like every time we would, try to raise that gate, it was you have to wait your time. And I think that is a great gateway to us getting a better service for the people that we serve.
Yeah, absolutely. I could not agree more. The providers that have folks enrolled really appreciate that because it helps them develop a relationship with the hospital. It's a more positive experience. And the hospital is usually able to let us know, okay, I can set up a room for them. Or, oh, hey, we're really busy, but I'm going to try to get them in as quickly as possible, do whatever they can because it's doctor talking to doctor.
Yes. Another follow-up question, if I might. You had mentioned that documentation would be provided as a result of this StationMD visit. Are you going to be making that available through email, or how is that going to be communicated to us, the provider?
Yeah, so when someone enrolls and Karen, when I send you the PowerPoint, there's a link on it, but I'll send you the link separately so you can send that too. There's an enrollment form that you fill out, and on that form, you identify who the after visit summary should go to. You can put in a fax number, you can put in an email, and it can go to you, the provider. Sometimes we have primary care physicians that say, "Hey, I want a copy too," just so I kind of know what's going on with them. Maybe it's the nurse at your agency, their guardian, whomever, their SSA, whomever. And then after the visit, that automatically goes in an email to them. So they get an alert and they can click on it, download it, save it, print it, whatever they need to do.
Can it be sent via a message to your cell phone?
Yeah,
That's something.
because if you have email on your cell phone, it can go directly to that email. Yep.
Email, yes, but the question really is, can it be sent as a message if you're not accessing your email through your phone?
That is a good question.
He means a text.
The reason I'm
Yeah.
saying that is I'd like to have something to carry with me to show in the emergency room that I
Yeah.
might be able to just, visibly have that accessible.
Let me ask on that. I've never been asked that before. So let me ask. And then, Karen, is it okay if I let you know that so you can email everyone?
Hmm.
Perfect.
Yeah, we will share it on the provider page following.
Okay, great. Thank you. That was a good question. I've never been asked that before. So let me make sure and then I will let you guys know. Great questions.
I have to say, Emily, this has just been a wonderful service for so many people. We appreciate that. And particularly that having the doctor call in has been a huge service for folks. And I appreciate that you're reminding people that this is, if we're going to access this as a service through the waiver, you meet with your SSA and team, and you have to make sure that it's defined as an assessed need like anything else. Goes through that routine process. So I want to let you all know that. And we just, again, really appreciate this service. We think it's absolutely terrific. And I know I see people on here that were part of the pilot, like I know CSI was and others, and it's very beneficial. But we want also just, again, want to make sure that it's something that's discussed as a team, included in the My Plan as a Service, if it's going to be billed to the waiver.
Great. Thank you so much. We appreciate it.
So I have another question.
Sure.
So I serve some individuals that has like barriers in regards to receiving internet service. And I know that you did mention that there are resources in regards to that.
Yeah, that would be something you would have to get with your team about and talk with the SSA to see, what resources were available. Could you use the internet assistance program through the department? What were the other community resources? So yeah, I would definitely get with your SSA about that.
We are
Okay.
still authorizing and enrolling people in our local internet assistance program, and then we build a department when people are eligible. So reach out to the SSA of the individual or individuals and request that if you have any issues, let Karen know and we can help try to troubleshoot. I think it does sometimes get forgotten about, to be honest, because it came out a long time ago. We kind of had a push during pandemic, and it's sort of gone away since then. But we do still have it available, so we can assist with that if there's a need.
Okay, I know Jamie had mentioned it to me as well during a med review, and I said I'm very interested in this as well. So yeah, thank you.
Thank you so much. I saw in the chat too, someone asked if our doctors are familiar with Prader-Willi syndrome. Yes, they are. All of our doctors have specialized training in working with individuals with intellectual and developmental disabilities. So you're going to have a great outcome from your appointment because they're specialized and they are familiar with Prader-Willi. Any other questions?
Emily, I just have a quick question, and I'm probably going to stick my foot in my mouth here. But have you seen, at least in other counties, are they treating, so if they're accessing Station MD as an urgent care, are they then completing a UI? Do you know if other counties are asking that the providers complete a UI for that visit?
I believe that they probably are because it's
I
a
would
medical
say it's-
visit like any other.
Yeah.
It's not a hospitalization and we're not the ER. So it is not an MUI. Certainly if you
Right.
went and, got admitted, then you would need to follow that. But it's my understanding from most providers that when they use it, they are completing a UI. I think
I
it
was just gonna
probably
say,
just depends
yeah, best
on,
practice would be, so just as a reminder, all ER visits and urgent care visits are UIs. So if you're using it for that purpose, I would recommend, yeah, doing a UI for that, just for tracking purposes.
Sorry, I was late to this party. I apologize. My other meeting ran over. Emily, did you go over before I got on here about the fact that we now have all the pilot folks already authorized? Did you already cover that? Okay, good. So we're good on those folks.
yes, you guys are great with that. We appreciate it so much. You were the first county and the only county so far. So we appreciate you guys so much. Thank you. Thank you. Yes, absolutely. You guys are rock stars. We appreciate you so much. If there's no other questions, we'll let you get on. I know you have a full agenda. If something else comes up and you have a question, Jen or Karen, just let us know. And I will get that one question answered in regards to the text. And we hope you guys have a great rest of your meeting and a great rest of your day.
Thanks so much, Emily and Sarah. We really appreciate you being here and the great information and the helpful PowerPoint. We'll make sure to share that on our public page, and it'll show up under communications as always. So along with the recording. So if you missed it or want to hear it again, it will be available.
Question.
so much.
Question, please.
Sure.
If we needed to address a question to someone, to whom is it addressed? Is it to you, Emily?
It would actually go to Sarah, and her email is in the chat.
I'll throw it back in there, just so it's a little more recent, Jen.
We'll make sure it goes to Karen too, so she can send it out as well.
Perfect. I just did it, Sarah. You're good.
Perfect. Thanks everyone so much. Have a great rest of
Thank
your
you.
day. Thank you. Bye-bye.
Next on our agenda, we are welcoming Cincinnati Tool Bank, and we have Taylor Brown and Kat Pepmeyer here to sort of share about the work they're doing and how we can partner together.
Hello, everybody. My name is Taylor Brown. I am the Community Engagement Coordinator at the Cincinnati Tool Bank. Before I kind of get into what we do, I just wanted to say thank you to Dawn for making this connection. She is on the board of directors here at the Tool Bank, and it's an awesome opportunity to be able to kind of share what we do and allow you guys to kind of express how we could best help you. We're really looking at enhancing accessibility and inclusion as far as what we already offer. And I would love to invite you guys to kind of throw into the chat as I'm going through what the Tool Bank does and what we provide, to make any suggestions, because what you guys do every day is not our specialty, and we would love to be able to kind of help that audience some more. So I'll let you guys know what we do, what we kind of already have, and then would love for you guys to kind of throw in ideas as they pop into your head throughout this. I don't have a fancy PowerPoint, unfortunately, but I do have our website pulled up here. So let me share that real quick. Can you guys see my screen okay?
Yes.
Awesome. It should say Cincinnati Tool Bank on there. And then this is our homepage. So what we do is we provide tools, equipment, and expertise to our nonprofit and charitable organizations. So in lesser terms, we have what you would think. We have a bunch of shovels and drills and lawnmowers and all that kind of fun stuff. Our biggest niche with our tool lending program is to be able to provide those tools to volunteer groups and other partners to allow them to kind of equip their volunteers to help do community projects. We are also in the practice of special events equipment, which is kind of where I see you guys being able to head. So if you guys do visit our website, we have a tab here that says tool inventory, and you guys can kind of just scroll through and see what things might make sense, whether it's in home, whether you're in a day program and you need some like neighborhood games, whether you need some extra extension cords for anything simple like that for maybe an event that you're throwing. The one thing that is new to our inventory more recently than not is our adult changing tables. So if you guys know anyone else who is throwing an event, or if you yourself are throwing an event for this community, they look very similar to this. They have the electric motor, so they're able to go up and down. It comes with the 4-way tent wall, so you guys are actually able to change adults and youth on this table during events and kind of have that privacy of being able to do that, which is super great. So that is something that's available in our inventory. Other things that we also are providing at this time are facility rentals. So if you guys were to have an event, we do have an ADA accessible building that has multiple different spaces. In regards to, obviously, I know like the training center might not be exactly what you're looking for, but if you guys wanted to have like a community gathering, we have a super awesome community space that's now available, as well as small meeting rooms if you guys were looking to kind of gather as far as internal staff to kind of discuss some plans and things that you guys have moving forward, that kind of thing. We also offer volunteer opportunities. So if you guys are interested in having some of your people come out in regards to volunteering, we have very inclusive all the way up to kind of working on small motors and things like that. So depending on what your skill set may be, we're very accommodating to all those types of things. We used to have Easter Seals Redwood come out regularly. And we would do a lot of like gardening around like our tool bank building. It can be super therapeutic for that. But we also did things like folding laundry, a lot of like independent living options as well. So those were all options outside of our actual initial tool offerings as well. But if you guys have any ideas of how we could also improve our inventory to be more inclusive and kind of enhance accessibility for what you guys are already doing, like I said, it's not our specialty. So we would love to kind of hear if you guys, one, have any questions about what the tool bank can do for you, but also any suggestions inventory wise. We're going to hopefully be able to start spending some grant money in regards to making our inventory a little bit more accessible to all types of people. So open to any questions that you guys may have. Let me open the chat real quick too. Yeah, absolutely. Go ahead. Oh, I think you're on mute, Jim. I think you're on mute, Jim.
Thank you very much.
Yeah, of course.
It
Yeah.
was just a test. I do that to confuse the enemy. Are there projects that would be listed, for instance? Do you have something perhaps in an ongoing manner on your site that we might see volunteer opportunities for the people that we're serving, that they might be able to come and volunteer and assist in whatever project that you have planned?
Yeah, for sure. So on our actual volunteer page, it has individual and then group and corporate, and then it says current volunteer opportunities. As things arise, I will be posting on that. And if you click on that tab, whenever you guys are potentially looking for a volunteer day, that's an option. And we also, what I would say is probably the easier option would just be to directly email me, and I can throw my email in the chat as well. I handle all volunteer opportunities, and I love catering to the individual or whatever your specific group is in need of. Like I said, when Easter Seals came out, we had 4 different locations coming out throughout the week, and one group was very, very mobile and able to do a lot of the things. Other groups were very static, and I had to do glove sorting, things that was more fine motor skill. So I love kind of hearing what you're already working with and then creating ideas from that. So it doesn't necessarily have to be something that we already have on our docket that we need done. We have other groups for that as well. But like love talking to you guys and figuring out what makes the most sense, what helps us, but also what helps you guys as well. So emailing me directly is also super easy in that regard.
Thank you.
Of course.
Taylor, it looks like there was a question about tool donations. Do you accept tool donations?
Yes, we absolutely do. The majority of our inventory is actually tool donations. We have a great relationship with Home Depot and Stanley Black & Decker. So as far as what we provide to the community, we like to keep everything kind of similar, looking the same so we can keep track of it better. But we also do accept tool donations for not only internal use, but we also do an annual tool rush sale, where if it's something that we can't add to our inventory, we love to kind of provide tools to our local community and neighbors that maybe can't afford them. So we'll also sell off like a drill for $2, or just things that we can't necessarily keep in hand, so people can kind of do their own home improvements without having that barrier with fiscally. So yes, absolutely accept tool donations.
Taylor, if you don't mind me adding, one area of growth over the next couple of years is also offering classes. I know there have been some classes that have been offered to students to learn about tools, and there are going to be classes offered to older folks about aging in place gracefully and learning how to take care of your own home. And then I can see a vision for opportunities to have folks with developmental disabilities who are interested in this type of trade, learning some skills there as well. So just stay tuned for that. I
Absolutely.
think there's gonna be a lot of opportunity for partnership around employment as well.
Absolutely, for sure.
Go ahead, Jim,
Did you
and
have a
unmute
question?
yourself.
Yep.
All right, thank you, Taylor. I belong to a civic league, and we look for certain things to support the proceeds that we have. Are you the contact person that they might have to see about an ongoing support?
Yeah, absolutely. So I do anything related community outreach, but so ironically enough, we only have a small staff of 3 people. So if you reach out to any of us, we can all help you in some regard. I used to be program and operations manager, which is the person that handles everything as far as like getting Civic League signed up as a member of the tool bank and then being able to borrow from there. But I can definitely be the initial contact and give them any information that they may be interested in. So if you guys have any like nonprofits that you know of that might also benefit from the resources that we provide outside of what you might do on a daily basis, we would love for you guys to share about the tool bank in that regard as well. We serve local schools. So even if you're a member of your local PTA, if you're a member of your local church, we do government agencies, faith-based organizations, local schools, all those kind of things. So it doesn't have to be a 501c3 for us to serve you. We don't serve individuals, but if you're an individual of one of those groups, community councils, neighborhood associations, we would love to just be able to put tools in your hands to kind of make the community better. I'm sorry, you're muted again.
You gotta unmute, Jim. Sorry, I muted you so we don't have feedback.
You are a 501c3 organization?
Yes, we are a nonprofit. Yes,
Great, great. Thank you.
of course.
We don't have any other questions for Taylor. Thank you so much for joining us and offering your resources. We really appreciate it.
Yeah, of course.
Anne, you are up to talk about Pig Abilities.
All right. Hi, everybody. I just wanted to tell you it's that time of year again where we are going to start training soon for the Flying Pig Weekend, the Pig Abilities event, which is the first Saturday in May. So this year, I believe that's May 3rd. So we will be meeting every Sunday at 2 p.m. at rotating locations. Our first meetup is on Sunday, March 2nd. Anybody that you support is welcome to join us. People can come with their friends, family, supporters. We gather at accessible spots and we walk up to a mile. It's a great way to not only get exercise, but to socialize and meet some new people. Our first meetup this year, there will be or the Flying Pig mascot there. So it'd be fun to get some pictures taken if you're interested in that. But we meet every Sunday leading up to that event. There will be a special event as well on Saturday, March 15th at the Cincinnati Zoo, and that is free for everybody. You would have to register for that. I don't have the flyer for that yet. The zoo is working on that, but as soon as we get that information, we'll share it out so that if you have anyone that you're working with that would be interested in going to the zoo, there will be a short presentation about Pig Abilities, and then we'll do a short walk around the zoo, and then you'll have the whole day at the zoo to do whatever you like. So this is open to all ages. Even if you don't run, that's fine. There are people that walk. And even if you use mobility device, that is fine. We have a lot of people, that come out with their wheelchairs or walkers, and that is absolutely, we welcome everybody there. The actual event that takes place on May 3rd, it's a lot of fun. I don't know if you've ever been to the Flying Pig Abilities event on that Saturday, but all of the events for the pig are really big. There's tons of people out there, And not only do you get to walk that, walk, run, or roll that 1 mile, you get a lot of stuff with it. You get like a shirt, a bag, a poster. It's just a really fun day. And this is just a great opportunity for people to get together and to, spend time together and exercise. So I hope you'll join us. I'll be leading all of these Sunday meetups at 2:00, and they're all on a bus route or a access route as well. So if you know anyone that can get there on their own, please share this information. I believe Karen has the flyer, and she will share it out with everybody. So yeah, that's all I had. I just want to remind you is that it's coming up. So in about a month, you can start to meet us up on Sundays, meet up with us on Sundays. Does anybody have any questions? All right. Well, thank you for letting me be here. I appreciate it, and I look forward to seeing some of you out there.
Thanks so much, Anne. You do have a question in the chat, Anne, if you could respond to that while I move forward. I do have
sure.
a few local updates that I wanted to share. We are switching to .gov this week for added layer of security. So if you have our old webpage bookmark, you'll see this pop up that says, please go to our new web address. So make sure you go there. Are you seeing my screen by any chance? Perfect. And so here's the new webpage. It looks very similar. It just has the .gov on the end at the top. You click on For Providers, that will take you on the homepage for your information. And as you scroll down, the provider forums are always uploaded here and any other information. So there will be another date here that has the recorded provider forum from today and also the PowerPoint. While I'm on this page, I'm going to show you a new development as we have started uploading ISPs into Salesforce. If you click on Training, OISP Britco, there's some helpful guides about how to access Britco, but the new one that's been updated is how to view an OISP. Then you probably aren't seeing the pop-up, is that correct?
Yeah, we're not seeing it,
Correct.
Karen. You might have to reshare.
All right. So here's the pop-up, here's the PDF that shows how to view the OISP in Britco. Historically, you could view the assessment and the service and support sections, the actual OISP, but with these instructions, you can now view the entire tool, the tool that has the whole packet. So all the attachments on the end, the cover page, you can see where it's sent out. So if you're missing that copy that gets emailed to you, you can locate it here. It's pretty easy, 3 short steps essentially, and you will be able to find that. And just as a reminder, this is only for ISPs that have been submitted to Salesforce, gone through that transmission. So roughly it's plans that were sent after 1/1/2025. All right. The other thing I just wanted to update you on is that DoDD received a grant, or DoDD issued a grant to OnScene to develop a provider search tool. And we've been sort of demoing that and providing feedback to the field. So it's something that we are looking into, and hopefully maybe in the next few months, we'll have a decision as we provide feedback, if they're making implementations, if that's a direction that we can go in Hamilton County. But we're really excited. We think it will add some improved functionality if we go in that direction with the ability to access things. The reason I bring this up now is that if we decide to go to transition to OnScene, this provider search tool, we will be reaching out to assist you in creating an account. It's pretty easy. It just uses your email and you create an account. But we want to make sure that providers have that opportunity so that we are offering free choice of providers to individuals with DD that are looking for a provider. And then the final thing that I have is that it's sort of a big thing is with electronic visit verification. You probably have hopefully been receiving emails and alerts and updates, but in October 1st, EVV to bill Medicaid claims for homemaker personal care, PD, HPC, waiver nursing, there will have to be a corresponding, a matching visit in EVV to be able to bill that claim. Otherwise, you'll experience an error. So it's just a reminder, you should be getting alerts now if there's not a match. Pay attention to those and make sure you have a great system in place for resolving those errors so that there's not a delay in payment on your end. And as a reminder, always don't bill a schedule. Make sure you're billing what's actually happening when staff are in the home. All right, so do we need to subscribe to BRIC Coach Review as a provider? No, HCDDS has a free platform for providers. So on that page, if the first attachment, the under communications OISP, our training OISP BRICCO talks about how to log on to BRICCO and steps to do that. So it takes you to a web page, you enter your email and create an account. If you have any issues, email our provider support and they will get back to you.
Karen, may I ask a question, please? Concerning electronic visits, are shared living providers covered
Nope,
under
not for
that?
shared living.
They are
Nope.
not.
Nope,
Gotcha.
you're good.
Thank
You're
you.
safe right now. So shared services for HPC are not covered under EVV, shared living. I did not mention residential respite. Residential respite, if you're billing the 15-minute unit, does require EVV visits. Also shared services do not. Sorry, I toggled back and forth there. But I did provide a link in the newsletter that walks down the list of actual visits that require claims. My understanding, Jael, is that you asked, will EVV need to be backdated or just beginning on the 1st of October? My understanding is that claims submitted after the 1st of October, if they don't have a matching EVV, they will be rejected at that point. Our ask of you is that you work on a system prior to that to make sure that you don't have a whole bunch of rejected claims and you're not able to bill. Any other questions before we move to MUI? Perfect. All right, Jenny, you're up.
I don't really have much. Just kind of wanted to remind everybody it's my favorite time of year, annual analysis. So save the date. We're looking at March 25th at 1 o'clock, and I think we'll do Zoom just because, yep, it's that time of year and keep the illnesses at home. And just to kind of give you maybe a preview of what we're to expect. There were 1,067 formal MUI numbers filed last year, and that made up 1,222 different categories. So join us on the 25th and you will find out more about that.
Thanks so much, Jenny. Any other questions or comments before we head off for the day? Jen, you've been quiet. Do you have anything to add?
Nope, all good over here. Just working on keeping up with everything. Glad to see everyone.
We can all be in the same, we're all in the same boat, Jen. So good to see everybody. Thank you.
Thank you guys for being here today and all your helpful interaction. We really appreciate it. I'll stay on for a little bit if anyone has any questions they didn't want to ask for the group. Thank you. Have a great week.